I did all of this, not just for myself, but so that my dad didn't have to bury his daughter like he buried his wife, because cancer hits at any age. It doesn't discriminate. That's the wonderful thing about breast cancer and a lot of cancers. They don't discriminate. Yes, Indigenous people, I think, do tend to have higher rates of certain cancers, but breast cancer shows up in anyone, so.
In my family, there's a lot of cancer, a lot of history of cancer. And so it's always been on my radar. My grandmother was a breast cancer survivor. 2 of my aunties, this is all on my mom's side, also breast cancer survivors. Another auntie had not just breast cancer, but also colon cancer. My uncle died of prostate cancer, and that's just in that one family. On my father's side, my father was a prostate cancer survivor. My auntie had leukemia, and so there was a lot of cancer and just awareness around, the importance of screening and taking that stuff seriously. Very early in 2021, my spouse said, I think we're behind for mammograms. I'm going to get those booked for us. Went and got the mammogram on a Friday afternoon, got a call back on Monday telling me that they wanted me to come back in the next day for imaging. I had ultrasounds, mammograms, talked with radiologists, and they flagged that I needed a biopsy, that there was some cells that didn't look right, and so that sort of began my journey.
There's no doubt that getting a call back on a mammogram is one of the most terrifying health experiences. Breast cancer is so common, people have all of these different, ideas of what it might look like and whatnot, and immediately jump to the worst case scenario. I would say don't panic if you get a call back. It is actually very common to get a call back and it ends out that everything is very reassuring. If you've never had a mammogram before, sometimes it's just really important to get some different views and some different images for the radiologist, and that is extremely common, especially with a woman's first mammogram. Sometimes it necessitates getting an ultrasound, again, just to get that kind of balance of images to really characterize what little abnormality they might see to see if it's anything of concern.
When I had all that imaging done, they didn't even find a tumor per se at the time, but they knew that there was something there that needed investigating. I had my biopsy, and within 24 hours, because it was a rapid diagnostic clinic I was involved with, within 24 hours I had a cancer diagnosis.
From a woman learning that she has a suspicious area in the breast on a screening mammogram, or her maybe identifying a lump that prompted her to seek out testing, to the diagnosis, which often is made in radiology with a biopsy, the first thing is generally they're referred to surgery. Now, in terms of similarities amongst a woman's journey, there's definitely key pillars in terms of the treatment of breast cancer. So surgery is an absolutely integral part for many women. Radiation, and where I come in, is systemic therapies. And so women definitely can participate in the treatment planning and the sequence of things.
My journey actually goes back all the way to my mom. So my mom, born and raised in Midland, she is one of, I think, 6 siblings. 4 or 5 of which all actually have a genetic mutation which makes them highly susceptible of having breast cancer and ovarian cancer. Unfortunately, I lost my mom really, really young. I think it was like 28 days shy of my 2nd birthday. She fought a tremendous battle with breast cancer, however, unfortunately passed away. That launched, I think, a huge inquiry into my family continuously getting breast cancer. My mom's siblings would randomly screen that they had breast cancer, and it's not often that you see so many women in one family having that kind of journey. And so they partnered up, actually, I think it was with Princess Margaret in Toronto, and they were part of a case study to understand, what is it in my family's genes that was causing them to have breast cancer? It turned out that we actually carry a BRCA2 gene mutation. No one knew if my mom actually had it because my mom passed away before all of these wonderful tests became a thing. The summer of 2020, I had bought a house, I had found my life partner, I was really stable in my career, and we made the decision that at that point, maybe getting a genetic test done to just inquire if I have it, and then taking steps if I so choose. It's actually a really easy test. It's a blood test. So it's nothing invasive. I just had to go ask my family doctor, and I did have to provide a lot of the genetic documents from my family. It came back, unfortunately, that I do carry the gene, which then I guess gives more piece to the puzzle that my mom did carry it, because I cannot carry it without my mom having it. You have a 50-50 chance of passing it down, and I guess I won the lottery in that sense of having the gene.
If you're concerned that your family history is quite suspicious, with first-degree relatives having breast cancer or at a very young age, I would encourage you to reach out and speak with your primary care provider or health team. If that physician or your primary care provider does agree that, the family history is suspicious, there's select criteria to qualify for what we call a genetics consultation or testing. So it's not a test that we would do on the general population, and with good reason, because really this is the minority of people in the population. And those results generally take anywhere from about a month to kind of 4 to 6 months, depending on the urgency.
So that news in the summer of 2020 really sent me on my journey of taking care of myself.
I had a lumpectomy, and the tissue that they took out of me, we sent that away for testing, and it confirmed that I actually did need not just radiation but also chemotherapy. And so I underwent 8 rounds of dose-dense chemotherapy, and there was 3 different types of chemo that were used over those 8 treatments, and it was a long several months. It was not a whole lot of fun. I learned a lot about myself, which that combined with having the best spouse on the planet and really, really good care, I managed to get through that process relatively intact. It's still awkward for me to introduce myself as a breast cancer survivor. I'm still internalizing all of that. I just last month celebrated 1 year from completing my cancer treatment.
The support from the program doesn't end, when you're finished your kind of active cancer treatments. There's significant survivorship issues that are recognized, and we do our best to continue to support women there, as well as connect them with excellent supports within the community and our partners.
I think for Indigenous women, one of the things that I think lacks in the healthcare system is the trust in our ability to advocate for ourselves. As a young or late 20-year-old, when I was navigating these systems, I was told at every stop, you're too young, you don't know, you're gonna wanna breastfeed, wait till you have kids, wait till this. And I was adamant that I had done the work in order to get me to that place, and at no point was I taken seriously by my GP, by different types of general surgeons. The only person who I never had to continuously advocate to was my plastic surgeon. She said I was one of the youngest people she had done this operation on, but she trusted that I knew what I was doing and that I needed to trust her. And that, I think, was the first person in that journey in a lot of my experiences in the medical system that really heard me. Because I think these really colonial systems, such as the medical system, has done such a great deal of harm to Indigenous people that sometimes we don't want to interact with those systems. And when one door gets slammed in our face, we go, see, I told you, and we just walk away.
One of the other tools that I think citizens should be aware of, here in Ontario anyway, there are Indigenous cancer navigators within many of the hospitals and healthcare systems. There are people that are very knowledgeable that can actually help you navigate your way through cancer care. And I would encourage you to reach out to those people.
We need Indigenous patient navigators in the healthcare system for so many reasons. Specifically looking at cancer care, we see that a lot of the work done in the hospital is physical, but we know that for everyone, and specifically for Indigenous people, that mental, emotional, and spiritual piece is really important to overall well-being. When you're looking at that holistic person or looking at a person as a whole, you need to address all parts of that person. And so the doctors can take care of that physical part, and I'm here to take care of that cultural, that spiritual, that mental and emotional part as well. We are Indigenous people working for Indigenous people. And for me personally, I'm an Indigenous woman working for Indigenous women and whoever else needs that support. Here at RVH, we do follow a self-ID process. So when you get asked that question, do you identify as Indigenous? If you're comfortable and able to say yes, you are also asked if you want to be connected with the Indigenous patient navigators. And then again, if that's a yes, we get that referral and we kind of take it from there. So what I will try to do as a navigator is I will try to find you and at the very least introduce myself, talk to you about the services that we provide and how we provide them, and really talk to you about what do you feel like you need at this point in time. So yes, 100% we do advocate for our patients and the people that we work with, and that may look different in different capacities. For example, maybe it might look like me sitting in the room with the patient and the doctor as they have their diagnosis or their reevaluation or a chemo treatment update. It can look like me walking with someone to their appointment to help them alleviate that anxiety or the stress that's happening. However we can advocate for a patient, we will do what we can do. And if I can't do it for some reason, then I will reach out to somebody who can. Reaching out to someone in the medical system who knows the system a little bit more is so beneficial to patients and to people who come through here, because then you can rely on someone to help you. And it really does alleviate some of that stress and anxiety that comes with, just generally being in the cancer center. Now, we do understand that there are instances where people don't want to self-identify and they don't want to talk about the fact that they're Indigenous. And this is largely due to the fact that there's fear of being stereotyped. There's fear of being discriminated against within those systems, the healthcare system. And so sometimes people, when asked that question, even though they are Indigenous, they'll say no because of that fear. And that is a barrier that we do face when we are trying to support our patients. We don't know if we're catching everybody because not everybody wants to self-identify. Now, with that being said, patients do not have to self-identify to be able to access our service. So for example, we have different ways for you to come and talk to us, different ways for you to reach us. We have a general email where people can reach out to us without having to identify. We are hoping that that helps with that barrier to accessing our care because of not wanting to self-identify.
Once we can get patients to come to the center, to meet or speak with our Indigenous navigator, to come and have a consult with the healthcare team, I find that anxiety is much alleviated, and I think we really are able to work together to work through a treatment process.
Being an advocate is, I would say, one of the top priorities of my job, to make sure that people who come in here and patients that come in here are receiving the best care and the best support that I can provide. I've seen people that I love go through cancer. I've seen people that I love die of cancer. And it's not easy. It's never easy. And that's where I think that really important piece comes in of community, right? We are a community of people who have been touched by cancer in one way or another. Especially as Indigenous people as a whole, we know that the cancer rates within Indigenous populations are way higher than those of non-Indigenous populations. I want to fight for you. I want to be here to support you and your family and your friends through a journey that nobody knows until you've been through it. I guess that would be my fight song.
There's a lot of people out there that just want to help and support, and so know that you're not alone. There's a whole community behind you.
I think my message is to talk about the journeys, because the more I've come out and openly talked about my story, the more I'm actually seeing that it wasn't an isolated story, that I'm not alone in this, that we can find our own community, right? I always talk about Métis people, it's like coming home. You're with family, and that we need to talk about these things amongst one another to be able to support each other.
When you give women that power back, not only as a whole for society, but give them that power back for their own bodies and for their own ideas and their own minds, There's such a beautiful thing that happens as we see that we are able to take control of our own health when we have that power, when we have that space to be able to thrive.
Cancer is so common. Again, 1 in 8 women. So if women get a diagnosis of breast cancer, it's really important to know it is nothing that they did wrong. They have cells, we are human, you are at risk of getting cancer. But there's no doubt that there's importance of eating real food and moving your body. And the more exercise you can get, the more active you can be throughout your life. Not only is that really important in terms of mental health, physical health, but definitely improves outcomes from a cancer diagnosis. And we have more and more data to support that.
Just the power of knowing that people are remembering you and that they're praying for you or they're thinking about you. It's a reminder that you're not alone.
As Indigenous people, a lot of times we are always told that we're really resilient and we can get through this and we can push through it. And in these moments, we are resilient, but it's okay to be vulnerable and it's okay to be soft and to be gentle with yourself. And the resilience will come. It'll come afterwards.
It's never too late. Just go out and get screened. There's no judgment. There's no kind of, points for getting them done every year or going once every 5 as long as you go. The potential benefits in terms of just reassurance if there's nothing there, which is the majority of women. But if something is found, being able to look into it and manage it earlier is definitely worth the inconvenience and overcoming that fear of getting it done.
Whatever your belief is, however it is that you navigate your way through the world, having people there that are expressing their care for you, whether you know them or not, I think that can be very powerful and very healing.